So, good morning, everybody. I am Shefalika and I am the Counselling Psychologist at Peakmind, and I'm here for a live session for all of you here. Before we take this further, I'll just give an introduction about myself. So, I have done my MPhil in clinical psychology from Dr. Ram Manohar Lohia Hospital, and I've been working in the field of mental health and wellness for the past 4 years. Here at Peak Mind, we work towards making mental health more acceptable, and we aim at creating a society which is free from the stigma of mental health, and we build towards an awareness for mental health. So, as all of us would know, mental health is an essential part of everybody's well being, right? And when we know that a person is mentally healthy, we expect them to be more equipped in terms of learning, and that is when they're expected to reach their full potential. While the general perception of mental health and illness has improved over the past few years, there are still questions surrounding it. There are still doubts that surround it and remain around it. With so many articles and so many information, specifically on the internet, which is floating around mental health, it is difficult at times to ascertain what is actually true and what is one is to believe in. So through this campaign of ours, no, don't assume, we wish to increase awareness and break the myths about mental health by answering a few questions which are most researched on Google. And as we interact, we'll try and take up few more questions that come on our way. So I'll begin by taking up these questions one at a time. So one of the first and the most important question that often comes to when we actually look up Google is, why is mental health important? Now, like I said, mental health is an essential part of someone's overall well-being, right? If a person's mentally healthy, they are equipped to learn better, they're likely to reach their potential. Not only that, it helps you, an individual, to cope with stress, with adversity better. You can make more meaningful contributions to your own personal life, to your professional life, to the society at large. You're likely to have a better physical health, and your overall productivity is also likely to be better. Not only this, you can also come up or cope with difficult circumstances better. So that's one of the few reasons why mental health is important to us and why one should look after their mental health. If I were to look at what signs one should look at when someone's concerned about, let's say, whether their mental health or their mental well-being is okay or not. So, well, to be honest, the symptoms of mental health or mental health conditions kind of vary, right? It's not specific that these are the symptoms that would run across. Depending on the illness, depending on the severity, depending on several factors, the symptoms could vary. However, what is commonly seen is that few signs and symptoms would run across different kind of disorder, right? So a few of them being withdrawal. So the person who's suffering from that mental health condition is likely to appear withdrawal. There could be mood symptoms in terms of sadness, there could be irritability, there could be anger, there could be inability to cope with their circumstances, there could be poor decision making, that the individual who's actually experiencing that mental health condition may find themselves to be in a difficult spot when it comes to decision making, not sure of what they would like to pursue, or just even simple decision would become effort for them. What commonly is noticed by family members, or let's say by significant people who are around the person who's experiencing the mental health condition, would be that there would be a change in their functioning, right? So how would they function prior to the mental health condition? There would be a change that one would notice, and this could be one of the softer signs that family members could pick up and would be able to tell you that there is a difference in the functioning that we see for this person. So that could be one of the earliest signs that they begin to notice, and of course the signs that I discussed alongside. So if we were to look at so this is one of the few signs that we discussed. If we were to look at in what ways would mental health affect, let's say, our physical health. So as we know, there's always said that poor physical health would impact our mental health, and vice versa. Poor mental health will have its repercussions on our physical health. So if we were to look at in what ways would this happen, so a lot of general medical conditions would exacerbate or would become more pronounced following a deterioration in one's mental health. So if I were to give an example, there is a common skin condition called psoriasis, right? So that's a skin condition wherein, let's say, the skin cells kind of build up. There is rashes, you would see small patches of skin that would be there. Now that's an autoimmune condition, right? The body itself causes this sort of a reaction. but the symptoms or the psoriasis in general is likely to flare up or become worse if an individual is experiencing stress. What also happens is, because there is a skin condition that is there, an individual is likely to feel more stress. This becomes a vicious cycle, right? So stress flares up the condition of psoriasis in itself leads to more stress, and this cycle between mind and body continues. If I were to look at other aspects in wherein mental health would impact us, like I said, mental health could impact an individual's decision making process. For example, if there is someone who's experiencing a condition and they would like to seek, for example, they would want to consult a doctor, or they would want to visit the hospital. Mental health conditions may itself impair their ability to access information on their health. They are less likely to even take care of their physical health. So this way, mental health would affect the decision making process. If I were to look at few lifestyle choices, it's commonly seen individuals undergoing mental health conditions are more likely to abuse substances such as smoking or such as alcohol. So again, here we do see how the physical health or the mental health of an individual would impact their lifestyle choices. Then there are other areas of one's life that also get impacted when someone is experiencing mental health. So if we were to look at when we're talking about impact, a very prominent question that comes up is how stress affects pregnancies, right? So if we were to look at stress, now stress affects pregnancy by increasing preterm, with chances of having a preterm birth, which means that before the actual 9 months pass, the individual might the woman who's actually experiencing who's undergoing pregnancy might have a preterm birth. There is increased risk of morbidity for the child. There's lowered birth weight. All of these are impacts of how stress affects pregnancy, right? And it is also seen the fact that the woman is undergoing stress, the mood of the person who's undergoing stress is also likely to be impacted, right? So this has a direct repercussions on how their mood stays is. Women who are undergoing stress during the pregnancy have seen to be reporting more anxiety, seen to be reporting more depression, and in fact, at home you would often see them, engaging either in crying all the time. So you would see that these women are experiencing these kind of mood states because of the fact that they are undergoing stress. If you were to look at what most likely are the reasons for mental health stigma that is around mental health, as we see, while we do know that a lot of effort is being made to raise awareness towards mental health, to get rid of the stigma that is associated with mental health, what research has indicated is that the predominant reasons for stigma around mental health is the lack of knowledge and the negative attitudes that surround mental health problems, right? So if there is poor and negative belief and there is negative attitude which surrounds the mental health conditions, it is likely to cause or likely to contribute towards the stigma that's surrounds this mental health condition, right? So going on, I do see that a lot of people have joined in. I would again take a pause and welcome everybody and thank them for taking out their time to view this live session, right? We'll go on. So another very prominent question that comes up in the field or comes up when you look at mental health is that does talking to your own self mean that you have a mental health condition or that you're mentally ill? Well, honestly speaking, not entirely, right? So you do see that a lot of people do engage in self-talk, right? So if I look at an adult, someone who's engaging in self-thought may actually be just thinking aloud. Thinking aloud actually helps us, articulate your thoughts more clearly. It helps you get more clarity on the thoughts and helps you also in decision making. So in this case, if an adult is actually engaging in self-talk, it may not necessarily mean that they are experiencing a mental health condition, given that there could be absence of other signs and symptoms. Let's say if I talk about children often do talk to themselves. Children as young as few years old often have imaginary companions that they make for themselves and they talk to themselves. So that is the process that they engage in, but that doesn't necessarily mean that they are undergoing a mental health condition. if we were to look at any signs and symptoms, we need to look at a larger picture and not just look at a sign or a symptom in isolation. So let's say if we do find an individual who is engaging in self-talk, rather than assuming that this person could have a mental health condition, it becomes important to look at what other signs and symptoms they may be experiencing, or in what context is this self-talk actually being engaged in. That would give us a better picture or a clearer picture with respect to what is actually happening with that individual. And if the need be, if there are other signs and symptoms that may be apparent or they may be prominent, then there is a possibility that this individual at hand might be experiencing some mental health conditions, and then appropriate referral or appropriate treatment may be warranted in that case. Along those lines, it's actually been seen that mental health conditions of individuals who are actually experiencing mental health conditions often require a routine. So it's actually asked that why is that they need a routine. So what's actually seen is that mental health conditions often disrupt an individual's life, and they often interfere with an individual's ability to focus on the task at hand. If there's any activity that they're doing, they might have difficulty focusing on that and actually completing that. So when you provide these individuals with a routine, it helps them to normalize a daily schedule that is there. It leads to an increased satisfaction and productivity as well. When they know that what is that they need to do, or what is the kind of work that they will be able to do, providing them with that clarity helps them actually align their own schedule along those routine, and helps them actually to be able to fulfill those requirements. So in that way, giving someone who's actually undergoing mental health difficulties, providing them a routine actually may prove beneficial to them in that case. If you were to move on, there have been a lot of questions with respect to are mental health conditions treatable? Are mental health conditions chronic? Are they going to be lifelong? Do we have to be on medication all the time? Or do we have to take medication lifelong? So if you were to look at, are mental health conditions chronic? So when we look at chronicity, or when we say something is chronic, what we are referring to is that there is something that is lasting for a long period of time, or it is marked by frequent recurrence, right? Or it's of a long duration in general, or it's likely to continue for a long duration. Now, if I were to look at mental health conditions specifically, mental health conditions could be categorized as chronic. There are certain kind of severe mental health conditions. To name a few, for example, schizophrenia, for example, bipolar disorder. These are mental health conditions that are likely to be considered as chronic in nature, which would require a long-term treatment in order to, let's say, get the individual to a more stabilized point of time. But the chronicity depends largely on the kind and the type of mental health condition we are talking about. If you look at, like I said, if you look at something like schizophrenia, it might be chronic in nature. However, mental health conditions such as anxiety or a depressive episode might not. So when we look at chronicity, it is not that it's a blanket term that we can look for all mental health conditions, wherein we say that all mental health conditions would be completely chronic in nature or completely long-term in nature. It would be dependent on the kind or the type of mental health condition we're talking about. Along those lines, like I said, a lot of people do question that are these conditions treatable? Like physical health conditions are treatable, likewise mental health conditions are also treatable, right? There is treatment, of course, that is available for all mental health conditions. For certain mental health conditions, one may require a longer period of time or a longer duration for the treatment to be there, so as to control the symptoms or get an individual to a more stabilized functioning, where they can actually take care of their own mental health and carry on with their everyday functioning. Certain kind of mental health conditions could be completely curable in nature, right? However, when I say curable, there is still a possibility that certain kind of symptoms or conditions may actually have a recurrence, right? So they may resolve for that time. However, at a later point of time, the symptoms or the signs for that particular condition may recur. Yeah. So going on. In conjunction to when we say that are mental health conditions treatable or are they chronic in nature, another pertinent question that kind of comes about in this direction is that do individuals with mental health conditions actually recover, right? So if we were to look at recovery, now, like I said, that since mental health conditions are treatable, they do respond well to treatment. You might experience some sort of a return or recurrence of symptoms, but if we look at in individual's condition, if he were to carefully monitor and manage the disorder at hand, it is very possible that an individual is able to live a fulfilled and a productive life. What is crucial here and what is central to the recovery process is early identification of the signs and symptoms and treatment, and a proactive and a full engagement of the person who's involved in that treatment, right? So as long as the person is involved and an adequate treatment is provided to the person who's experiencing these mental health conditions, we are likely to believe that recovery is possible, and we can actually bring down the individual to a very to a high functioning state, and they can lead to a productive life, right? So again, in conjunction to these questions, another question that becomes very important is, do mental health conditions run in families? Is it a heritable condition? So mental health conditions actually can run in families. If a family member is diagnosed with a certain mental health disorder or a mental health condition, it is likely that another family member may have a similar disorder, right? So the likelihood of another family member having a similar disorder becomes high. However, it does not necessarily mean that if you have a person with, let's say, for example, if there's someone who's diagnosed with depression, that another family member will also be diagnosed with depression. Whether the condition develops in another individual or not is, there are several factors involved in it. Genes or hereditary factors are one type of factor. There might be other factors which could be psychological factors or environmental factors, which would play a role in the expression of those signs and symptoms in another individual. Right. If it were to go on, so again, very important question in the treatment of mental health condition is that if someone, let's say, is prescribed treatment, they are given medication, can they actually stop taking these medication, right? So one, if someone starts feeling better, should they stop taking medication? Now, there are very two important points why people would stop taking medication. The first being itself in the question that once they feel better, people assume that it's okay for them to actually stop taking medication. For them, it may seem reasonable to stop taking medication. Another situation wherein people actually discontinue taking medication is if they start experiencing certain kind of unpleasant side effects, right? And now in both these cases, while it may seem reasonable to stop taking medication if one feels better, in case of psychiatric medication specifically, it is very, very important and very crucial that this decision is taken in discussion with your treating physician or your treating psychiatrist. Two, let's say if there are actually unpleasant side effects that one may experience post taking the medication, it makes sense that the individual may feel that I should stop taking the medication. However, it is again very important that this discussion happens with your treating physician or your treating psychiatrist, because psychiatric medications would have their own withdrawal symptoms, which may actually be very unpleasant in nature. So it's very unlikely that the doctor would stop giving you that medication right away. There might be a gradual reduction in the dose that the doctor would follow before they actually wear you off the treatment. So in order for you to stop taking the medication, it becomes very, very important that you have a discussion with the treating physician, and the treating physician would be actually the one who's actually providing or you prescribing you the medication. Just having a discussion with a mental health professional may not be sufficient, because they may not be aware of the kind of circumstances under which the medication is given and what the medication is. So it becomes important that the treating physicians and the treating psychiatrists are the people that you do have this discussion with, following which, on their advice, you can follow the process that is recommended by them. Right. Okay. So again, as another very important question that comes up in this process is addiction a mental health disorder? Is addiction actually a mental health condition? Yes, the answer to this question is actually a yes. Addiction is classified as a mental health disorder. Now, while people feel that, that mental health conditions are separate and addiction is actually a separate thing or a separate entity, what is important here to understand is addiction in any kind, whether it is to drugs, whether it is to alcohol, whether it is to another substance, or let's say a recent classification could be, let's say, the internet addiction. All of them have long-term impact on the individual's ability to function daily, and the symptoms that kind of come about alongside this have caused significant distress to the individual. So there is a obvious socio-occupational decline that one sees in case of addiction, and that's why this is one of the very strongest reasons why addiction is classified as a mental health condition. So yes, to answer the question in brief, addiction is a mental health disorder. And I do see a lot of people have joined in. Thank you everybody for joining in, and we're in between the process. So if there is any question that anybody would like to ask, they could write this down here, and I'll try and take it up. Right. So going on, so we've spoken so far about why mental health is important, what could be the potential signs or warning signs of mental health conditions, why mental health conditions are mental health conditions diagnosable, are they treatable, can someone be cured, do they require treatment. If I were to ask that, like a lot of people have asked this question, that why should someone, or rather if they do happen to know someone who's been diagnosed with a mental health condition or appears to have a mental condition, what should they do, right? So let's say if you happen to know someone, let's say for example in your immediate friend circle or in your family, that you do feel could have a mental health condition, what do you do? So first and foremost, I do understand that, having this conversation, especially with the person who's actually experiencing these difficulties, it might be difficult to do so. It's a tricky conversation, right? And because of that, a lot of us actually may fear having this conversation, that what if it leads to an argument, or what if this is not, that's not acceptable to the person who's, concerned. So it does get tricky. It's completely understandable. However, what we can do from our end is, one, be empathic to the fact that they might be experiencing someone, right? Letting them know that you're there for them, conveying that, it's not that they see that they're different. The fact that you do understand they're experiencing something and you are there for them and you are ready to offer that help is the first and the foremost thing that one needs to do. Rather than, panicking that there is something going on, remaining calm and remaining focused, and the sole idea being helping the person who's at hand, and realizing that they are in need for treatment is very, very crucial. So in that sense, that's the first thing that one should do. The other thing is, you also need to let the other person know that there is treatment option while they're experiencing difficulties which might be distressing to them. There are treatment options available to them. They can speak to a mental health professional, whether it is a psychiatrist or a psychologist or a counselor, and they can provide them with the required help. Sometimes the person who's actually experiencing mental health condition may not be in that state or frame of mind where you can have this sort of a conversation. They might actually feel that it's not a problem with them, but the problem lies in other people, and that happens more often than not. So in such a case, aligning yourself with the family members becomes very important. You can choose a few concerned family members who you feel will understand what is actually going on, and having this conversation with them may actually be helpful. I do see there's a question that is put up. Can mental health conditions be treated via counseling alone? So this has been asked by Vigorously Vivid, right? So there are few mental health conditions that can be treated by counseling alone. So we have seen the efficacy of counseling, or let's say therapy for anxiety conditions or depression for that matter, that they can be treated with counseling alone. However, it has been seen that the combination of both counseling and pharmacological management, which is medication based management, has the highest efficacy. That in terms of treatment efficacy, that is the highest efficacy when the two of them are used in a combination rather than standalone treatments. But to answer your question, can they be treated via counseling? Yes. If they are not very severe mental health condition, they are not chronic in nature, it can be treated via counseling alone. So I do see that you are putting up your questions. So if there is any other question that anybody would like to ask, I would want them to type it out on the chat box, and I'll see if we can take that up. Right, so I can see Mitesh had asked this question. First, thank you for joining in, Mitesh. You've mentioned that how do we find out if the person is going through a mental condition? Are there any symptoms? So I think I discussed this, but I'll still go over this question again since you put it up here for the benefit of everybody here. That there are so mental health conditions, every mental health condition would have its own signs and symptoms, right? So it's not a generic sign and symptom that would run across all disorders. However, there are a couple of signs and symptoms which could be considered as early warning signs that one could look at if they have an individual or if they know someone who's actually experiencing mental health conditions. So few of them, like I mentioned earlier, one of them could be withdrawal or isolation, wherein the individual who's being concerned at hand actually do isolate themselves. They stop interacting with the people around them. They start being alone a lot more than they would otherwise do. So that's one thing that we do notice in people who are experiencing mental health conditions. There are mood symptoms that we see, that in terms of their emotions, in terms of their feelings, we do see a lot of anger outbursts that comes about. There, a lot of irritability. There might be feelings, there could be sadness associated with. A lot of people who are experiencing mental health conditions have often seen to be experiencing mood symptoms in terms of crying out loud. So that's one thing. Their overall productivity, there might be an obvious change in the productivity levels that you see for these individuals. So that could be one of the signs and symptoms that we see. In general, what we do see is that an individual who is experiencing mental health condition or is on the verge of developing a mental health condition, there might be an obvious decline from in their functioning levels, right? So how they would function prior to the onset of the illness, there would be a difference that one would start noticing. It might not be a very drastic decline in functioning that you would see. It might be a gradual decline in nature for a lot of us. For few, it might be a complete, like 100% change that one would notice. So these are few signs and symptoms that one could look out for when they're looking at, they're trying to find out if someone they know is actually experiencing mental health condition. I hope that answers your question, Mitesh. Right. So I'll go on. If there's anything anybody else would want to ask something, again, they could just type it out on the chat box. Right. So another very important question that comes up in this aspect is, do mental health conditions increase with age? So if we were to look at this question, so there hasn't been a very direct relationship that has been found in increase in mental health conditions or increase in the symptoms of mental health conditions with age per se. So mental health conditions or mental health disorders is not considered to be part of normal aging per se. However, we actually have seen in terms of a trend that most mental health conditions do in fact develop in younger people more often as compared to older adults and the elderly. However, a direct correlation that as one would age, would their mental health condition deteriorate hasn't been established for now. Right. Right. So if I to go on, another very important question that comes in, when we look at mental health is this difference between, mental health or mental illness and mental retardation, which now is referred to as intellectual disability. So if we were to look at that, so they are two distinct conditions, right? If we were to look at the difference, the first and the foremost is they are actually two different conditions. Mental retardation or an intellectual disability is basically a case of arrested normal development. So the normal intellectual development of an individual is arrested at some time in their development period. Most often than not, it's usually seen before the age of 18 years of age, where we see that arrested intellectual development. So that is the case when in the case of mental retardation. But if we were to look at mental illness or mental health disorders, they are more widespread in nature. They affect your emotions, they affect your mood, your perception, your behavior. So, and there are of course more biological, psychological, environmental factors that are contributing to it. Mental health or mental illness may not necessarily be correlated with intelligence per se. There is a possibility that someone who's experiencing a mental health condition may also have intellectual disability, but they can also occur independent of each other as well. Right. So yeah, going on, another question that becomes when one is trying to actually seek mental health advice, or they're trying to figure out who do they go to, this question that often pops up is, what is the difference between a psychiatrist and a psychologist? Who do I go to? Will a psychiatrist be more helpful, or would the psychologist be more helpful? So the first and the foremost thing here also is to understand that both psychiatrists and psychologists are mental health professionals, right? So they are people in the field of mental health and wellness who can help you. who can actually provide you the necessary guidance that would be required in terms of your treatment. The biggest difference that is between a psychiatrist and a psychologist would be that a psychiatrist would have a medical degree, right? So because they are licensed medical professionals, they would be in a position to prescribe you medications. In that sense, a psychologist is not permitted to provide you with medication because that's not their field. That's not their education, or their degrees that they have completed in their field is not related to medicine. They have their education in the field of psychology, wherein that's the kind of psychotherapeutic treatment that they offer. So the difference primarily lies in the kind of educational background both set of people come in. However, both set of people are mental health professionals who can provide you with the necessary treatment. Right. I do see a question that is there. How important would you consider is the role played by a balanced diet in maintaining a healthy mindset? So I think that's a very good question, because a lot of people do ask that why is let's say maintaining a balanced diet or having a good nutrition important to keep a healthy mindset. So one, the keeping a balanced diet or eating a balanced diet is required first to maintain your physical health, right? As we all know that eating nutritious food and maintaining a balanced diet is related to taking care of your physical health. And as we discussed, there is a strong linkage that we see between our physical health and our mental health. Physical health conditions actually sometimes do buffer you from developing mental health conditions, and vice versa, that if you have a mental health condition, it can have a direct impact on your physical health. Poor mental health conditions are associated with physical health. So when one does take care of their dietary intake, when they are actually having nutritious food, that physical health is taken care of, and it can help you with respect to your mental health conditions. Yeah. I do see a question. Anmol has asked, what signs should people look for before seeking professional help? I think this is a similar question that Mitesh had asked above. So again, I'll just give a quick brief to you, Anmol, that when we're looking at signs and symptoms, there are a couple of warning signs that would be relevant that one should look out for if they have someone that may be experiencing mental health conditions. So we spoke about withdrawal and isolation. The individuals who either are on the verge of developing a mental health condition or are actually undergoing a mental health condition, they do experience withdrawal and isolation. They try and keep within themselves. They don't interact as much, and they may not enjoy that sort of socialization which they would do previously. So there is a change that we notice in terms of their socialization levels. There could be mood symptoms which could be persistent sadness, or there could be persistent irritability. There could be feelings of anger associated with that we see. There could be abuse of drugs, or there could be abuse of alcohols. A lot of people who are undergoing mental health conditions, we do see that their nicotine intake also increases. You might find people having difficulty to cope up with regular everyday life circumstances which they would be able to do otherwise, but now you see that they're not able to do that. Their decision making also might be impacted, right? So it has been seen that individuals who are undergoing mental health conditions, or let's say are on the verge of developing a mental health condition, might have difficulty in making adequate decisions. What is important here is that you would notice in most cases a sudden change or a gradual change in the level of functioning. So their level of functioning previously to them developing the mental health condition, and post that there would be an obvious change that one would notice, and this could be one of the earliest signs that we actually do see in people who are experiencing mental health condition. So that's something that we can look out to before we actually seek professional help. Or what also becomes important is that, let's say if there are unexplained occurrences, let's say if you do find a family member who's either appearing to be anxious for no reason, or let's say is you can see that they are actually crying, or they're appearing to be persistently sad, and you cannot identify a reason, that could in itself be an indication that there is something wrong. It may not necessarily mean that there is a mental health disorder that we're looking at, but there is some kind of mental health concern that they might be experiencing, and providing them the help at that point of time itself, like an early identification and treatment, would actually prove to be more beneficial for them. So I hope that answers your questions and more. Right. Yeah. So Shefali has answered question that does food have a linkage with mood? Well, yes, we have seen that a lot of food is associated with mood. So we do see that certain kind of, like for example, food items that have sugar in it, right, that are high on caffeine or let's say are high on sugar, have been associated with an upliftment of mood. So that is something that we do see. So yes, in terms of answering your question, that food does have a linkage with mood. Right. So we'll go on to a few more questions that are important in that have been repeatedly, I think, looked up on Google or have been asked with respect to this. So I'll go over that. So one of the important question that comes is that there is a notion that all people who are experiencing mental health conditions seem to talk to themselves, or the question that often comes to a lot of people's mind is why do people with mental health conditions talk to themselves? So now there is, if I were to look at this as a symptom, so in terms of, let's say, if this was actually a symptom, what we would technically call it is called hallucination, right? So in other words, this hallucination or this auditory hallucination wherein people appear to talk to themselves is basically a sign and symptom of more severe or more chronic mental health conditions such as schizophrenia, where we feel that the person is actually talking to themselves. There's nobody around, but yet they appear to be talking to themselves, but they're actually replying or answering or talking to a voice that they come in, that comes in their head, right? So while we may not feel that we can hear anything, but for the person who's actually experiencing this mental health condition, these voices are as real and as as genuine as, let's say, I am talking to you. So they could hear it actually as clearly. And for them, since they're able to hear this voice, they actually end up responding to them. So while it appears to us that there's nobody and they're not responding to anybody, for them, they're actually responding to them. So that's why they do appear, let's say, people who are experiencing this sort of a sign or a symptom of auditory hallucination. That's why it happens. Right. I do see a few more people have joined in. Right. So, okay. So a couple of more questions that were there. So, a few people, I think, a user had put up this question: can counseling be a standalone treatment? And another question around similar line is that is counseling a substitute for medication, right? So again, like I had previously mentioned, that counseling can be a standalone treatment for less severe or less chronic versions of mental health conditions. However, if you were to look at as a substitute, I won't call it as a substitute for medication. We would mostly look at as an adjunct or in conjunction with the medication bit that we are talking about, right? So like I said, that medication and counseling together have found to be more efficacious in treating mental health conditions as compared to either one of them in terms of a standalone condition. Another very important question that often has been asked is it possible for someone to become addicted to, let's say, the medication that is prescribed to them, right? So is this something that they become dependent on, and do they have to, because of that dependence, continue this medication? Well, if we were to look at medications, in most cases, psychiatric medications or mental health conditions, the medications that we do provide, they are safe in the sense that they don't depend, you don't usually develop a dependence. However, theoretically, if you were to look at this concept, it is possible for someone to be emotionally dependent on the medication. So when I say that you can be emotionally dependent on medication, what I'm referring to is this fear that you will not be okay without continuing this medication, and you would be required to continue the medication because of that reason. That is an emotional dependence which someone may develop. However, the physical dependence of being physically dependent on medication is unlikely to happen in most circumstances. The only class of drugs wherein dependence can be seen is the class of drugs which is given for anxiety disorders. So these drugs are actually highly addictive in nature, and that's why they are closely monitored and regulated by the treating psychiatrist. So usually you won't find them being prescribed openly to someone. The psychiatrist would look at regulating the dosage of your medication and seeing if there are any dependent signs that they see for, the individual who they prescribed with. So in that case, yes, for anxiety disorder, specific classifications such as benzodiazepines, which we call, that's a group of, that's the classification which is, highly addictive in nature. Other than that, mostly the psychiatric medications that are provided, they aren't dependent. You are unlikely to become dependent on them. Yeah, I think if there is, so I think this is mostly what, if you were to look at the most frequent questions that are being searched on Google with respect to mental health conditions. If there is anybody would like to ask a question. Okay, I do see a few questions. So, Shreya has asked, is mental health treatment expensive? If you were to look at mental health treatment, so if we were to look at India as a setup, you do have mental health treatment options both in the government sector and the private sector, right? So in the government sectors, if you were to look at government hospitals or government dispensaries or the initiatives that the government has taken, that way, yes, we are trying to standardize the treatment and almost make it as easily accessible in terms of finances as well to individuals. Yes, in terms of the private sector that is there, the cost of treatment is different across different hospitals. However, what is recently being done is that we are looking at insurance that is being provided to make this more accessible. So in that sense, while the treatment might be expensive in, let's say, the private setup, there are these initiatives and insurance policies that are being revised so as to incorporate mental health conditions as well. What kind of so Priyanka has asked, what kind of support can friends and family provide to a person showing signs? So okay, so if you were to look at that, family does play a very important role in terms of dealing with someone who's actually diagnosed with a mental health condition. So one part, like you said, that the kind of support that they can provide is they need to be patient and calm themselves, right? If they panic or they become angry at what the person who's undergoing the mental health condition is doing, it is likely to make things more difficult for the person, right? So a lot of times what they may be acting or the way they may be behaving is something that they're not aware of or is not under their direct control. So instead of getting angry or getting upset at these individuals, providing them with a supportive and a very empathic outlook is going to be helpful. Saying that you need to be empathic, you need to show them the love and the concern that you have for them, does not mean that we need to abide by everything that they're saying. So a lot of times they might resist in terms of saying that they don't want to take a medication and they will not take a medication. So in that way, it's not that by being supportive you kind of encourage them that don't take these medication, right? So while we are trying to be supportive, we also need to act in their best interest. So whatever that is required, let's say, in terms of their treatment, in terms of their management, is what we need to do. A lot of times our own, so let's say as caregivers, when we are taking care of someone who's undergoing a mental health condition, sometimes the way we may actually express our own emotions may make their symptoms even worse, right? So if we are upset or if we are angry towards them, it is likely to cause more difficulty to them. So having a check on our own emotions, our own mental health rather, and our own physical health also becomes very crucial in that sense. So yeah, I think so we've looked at, in today's session, we've looked at the kind of questions that usually come up in our mind when we look at mental health conditions, and the kind of a few people would have doubts, few people would have concerns, and I think that's what was the agenda for today's live session, and that's what we've tried to do so far today. I do see another question being put up. So Priyanka has asked, what are the effects of COVID-19 pandemic on the mental health? So if you were to look at COVID-19, so we've seen that, since COVID-19 has come up, there is a lot of mental health concerns that have, emerged around it. So most frequently or the most commonly expressed mental health concerns with respect to this is anxiety, given the uncertainty, given the nature of the pandemic itself, where there is so many new information coming in. Every day we do get to know that a new strain has come up, or there's a new treatment, or there's a new vaccine that has come up, there is so much concern surrounding that aspect that a lot of people are actually experiencing anxiety. There is a lot of mood symptoms associated with. There's a lot of irritability that one sees. There are depressive symptoms that also, are becoming more apparent. There's of course that stress of also, not knowing what to expect, that sort of uncertainty that kind of comes about. So these are the few, effects that we do see in terms of, COVID-19, specifically in terms of mental health. Of course, from population to population, these effects may vary. So if we were to look at children, right, so given that these, children are not being able to go to school, they're not being able to socialize, it has direct impact on their own development skills. So a lot of children these days are facing difficulties in terms of making friends. So what this is a behavior that they would also learn, in their own environment when they would see other children. So not having that sort of exposure also has an impact in terms of, their socialization skills. A lot of them are becoming more dependent on technology, right? So because parents are also working from home and their children are also around, a lot of time parents are encouraging, by default it kind of happens that they're encouraging the usage of technology. So a lot of children are now spending excessive amount of time, utilizing mobile phones, or, watching videos, because that's what is available to them. So they can't go out and play, so that's what they have to resort to. So that gets impacted. If we were to look at the working population, so people are working from home, so a lot of people have now started mentioning that the boundaries between their personal and their professional life are getting blurred, right? So the work life balance is getting compromised because of the pandemic and the fact that we are working from home. So I think these are a few of the effects of COVID-19 that we've seen so far on mental health, if you were to look that. I hope that answers your question, Priyanka. Right, I think as we are approaching the end for this live session today, I would like to thank everybody for taking out time and joining this, live session. I hope whatever doubts, whatever concerns that you had around mental health and around mental health conditions, we were able to answer at least a few, if not all. So this was an attempt from our end that we wanted to do. So if we were to just give you a small idea, so as I mentioned, the No Don't Assume campaign that we've started. So every Saturday, that's the campaign that we're looking at. And so I would want you guys to come in and join the next Saturday as well. We'll mention the time, and we would want you to be a part of this. Thank you everybody for joining, and I hope everybody had a good time. Thank you so much.